Should pancreatic pseudocysts be drained? Imagine finding a fluid-filled sac in or around your pancreas. That's what a pancreatic pseudocyst is. These sacs often develop after pancreatitis, which is inflammation of the pancreas. Whether they need to be drained depends on several important factors. If the pseudocyst is causing symptoms like persistent abdominal pain, nausea, vomiting, or trouble digesting food, doctors usually recommend drainage. These symptoms can significantly affect quality of life and may signal that the cyst is pressing on nearby organs. Drainage is also advised if the pseudocyst becomes infected, starts bleeding, ruptures, or causes blockage of nearby structures like the bile duct or intestine. If the cyst is growing larger over time or pressing on other tissues, removing the fluid can prevent further complications. Sometimes, if there's uncertainty about whether the cyst might be cancerous, drainage can help with diagnosis by allowing doctors to analyze the fluid for abnormal cells. On the other hand, if the pseudocyst is small, not causing any symptoms, and remains stable over time, it may not need immediate treatment. Many small pseudocysts resolve on their own without intervention, so careful monitoring with imaging tests is often enough. When it comes to how to drain a pseudocyst, the most common method today is endoscopic drainage. This minimally invasive approach uses an endoscope guided by ultrasound to create a pathway from the cyst into the stomach or small intestine. It has high success rates and fewer risks than traditional surgery. Surgery used to be the main option but is now reserved for cases where endoscopy isn't possible or if the cyst keeps recurring or looks suspicious for cancer. Surgical procedures connect the pseudocyst to parts of the gastrointestinal tract to allow ongoing drainage. Percutaneous drainage involves inserting a catheter through the skin into the cyst under imaging guidance. While it can be useful in certain critical cases, it is generally less favored because it can cause discomfort, clogging of the catheter, and higher chances of needing additional procedures. Every drainage procedure carries some risks, including infection, bleeding, injury to nearby blood vessels or pancreatic ducts, and the possibility of the cyst coming back. Endoscopic ultrasound guidance has improved safety by helping doctors avoid blood vessels and other sensitive structures during the procedure. Deciding whether to drain a pseudocyst depends on its size, location, symptoms, and whether it's causing problems. It's also important to distinguish benign pseudocysts from cystic tumors of the pancreas, which can be precancerous or cancerous. Sometimes, fluid from the cyst is analyzed to help rule out malignancy. In the context of pancreas health and pancreatic cancer, managing pseudocysts carefully is essential. Proper treatment can prevent complications that might worsen pancreatic function. Always remember that each case is unique, and a healthcare professional can provide personalized advice based on your specific situation. If you or someone you know has a pancreatic pseudocyst, consulting a specialist is the best way to determine the safest and most effective approach.